What's going on, guys? Welcome back to W.D.Y.D. CSP. What do you do as a central sterile processor? All right, guys, today I want to talk to you about the black coating of surgical instruments in sterile processing. Okay, I know you guys have seen it before, and I just want to distinguish between the different types that we have. There are three, okay? Three black coating of surgical instruments that we typically see. So let's go through each one of them. All right, guys, so let me show you first an ebonized instrument. Okay, the full instrument is coated black. It has a dull finish to it. Now this one here, I often see technicians confuse it with a insulated instrument. Okay, it is not the same. From the distance, they may look the same, but an ebonized instrument and an insulated instrument are completely different. This is what we typically see as an insulated instrument with some metal exposed. That's an ebonized instrument completely coated. Now, when you have a partially coated instrument with black rings or black shaft, okay, it denotes the special function of the distal tip of the instrument. Now here we have a completely black coated instrument, but it has a mirror finish. Again, denotes the function of the distal tip of the instrument. Just like this needle driver here, looks like it's ebonized, but you see it is a partial coating. Okay, it denotes that this instrument has a special tip, which is diamond dusted. Okay, that is a diamond dusted grip tip on it to increase the durability of the grip and of the needle driver. Now, why do I want to distinguish between the three? Because again, I just stated that some individuals may confuse this as an insulated instrument. So what happens if we do an insulation test on these instruments? Well, on a fully insulated instrument, which function is to provide comfort and prevent any kind of electrical current reaching the patient or going through that device, there's nowhere to attach the ground to actually test this. You have to rely on visual inspection, naked and enhanced visualization for any damages on that insulation. You want to feel for any chips or cracks, and if you see any, you want to remove it out of service to get it repaired. Now, if you have exposed metal on an insulated instrument, you can attach the ground to it. And then using the proper attachment, you're going to brush or you're going to hover over the device to see if there's any break in that insulation. You should not get a reading anywhere along that device except for the distal tip where the electrical current is supposed to be delivered. What happens if we do this with an ebonized instrument? Well, it doesn't matter where you place the ground, electrical current will freely flow throughout that instrumentation. That is not the purpose of an ebonized instrument. Okay, we'll talk about the purpose in a few. What about a partially coated instrument? That denotes the distal tip function. Again, you can attach the ground to it, but electrical current will flow freely through that device. Something that we don't want. So this won't be used with an electrical current. Let me show you with my supercut scissor. Okay, I'm attaching the ground onto the black rings. It doesn't prevent the current from flowing through that instrument. All right, let's get the insulation tester out the way here. Okay, remember, partially coated black denotes the function of the distal tip. If you have an ebonized instrument, this instrument is used during laser surgery. It is used to prevent the reflection of the laser during use. So it is important to inspect that device for any kind of damage of that surface. Also very important to never place the device in an ultrasonic cleaner because it will remove that special coating. Okay? Our insulated devices are used to protect the user and the patient. When an electrical current is delivered, you do not want that current escaping anywhere around that device except for the distal tip where it's meant to be delivered. A fully insulated instrument is to provide comfort and prevent any and all electrical current from reaching anywhere along that patient's body where it's being utilized at. All right, you have insulated, ebonized, and partially coated for function. All right, guys, as always, stay true to yourselves, keep it 100, continue educating yourself. Till next time, peace.